We planted our first seeds in 2006 at the Fann Hospital in Dakar, Senegal. Dr. Sow, the director of the infectious disease ward, was unable to treat his malnourished patients. DIG helped Dr. Sow transform an empty lot behind the hospital into a vibrant garden. This garden still exists and provides over 50 free meals every day to hospital patients. This simple project was so impactful it needed to be replicated at other institutions. DIG's gardens create a space for fellowship, where participants form community support networks. When we began implementing home gardens, we saw that these spaces helped feed and provide an income to otherwise struggling families. DIG, having chosen to operate as a grassroots organization, consistently runs into the challenge of being unable to meet the demand for our projects. We often have to refuse project partnerships because we don't have financial or personnel capacity to ensure success. That's changing, though. We're hiring more host country nationals and training our participants to do project extension themselves. Today, we operate in 3 countries simultaneously, with more countries being considered. We're focusing on building local DIG chapters and strong national staff throughout Africa. DIG works directly with individuals and communities to address their most important needs through sustainable agriculture, tailoring the program to food security, nutrition, maternal and child health, and income generation. After creating a strong demonstration and training garden, DIG supports individuals to build home gardens. Investment in these families yields a 3-to-1 return. On average, each family who receives $100 in home garden support saves and earns $300 per year on food expenditures and income through produce sales. By working at institutional, community, and individual levels, our model has significant impact on our targeted areas. DIG's phased project approach transitions from agriculture skills building to community and economic development. DIG's model engages institutions, groups, and organizations to work together to demonstrate and promote sustainable agriculture programs and benefits. Best agriculture practices are shared as more people participate, which encourages a deeper collaboration between neighbors, more opportunities for communication on other health and environmental issues, and a continued engagement in advocacy of sustainable agriculture and health. With this model, real movements and scalable transformation of entire communities can take place. DIG tracks success through indicators related to institutions, communities, and families. In hospitals and clinics, we count the number of meals provided from the garden as well as monitor community attitudes about the services provided. For schools, we track how many students and parents participate in garden trainings. We also count the number of supplementing meals produced and home gardens built by students. In addition, we monitor students' academic performances. For communities, we track the diversity of produce consumed or sold, how many new sustainable agriculture practices are used, and observe how social cohesion has improved. And for families, DIG measures success by the number and quality of home gardens developed. We monitor household food security, income, and diversity of produce consumed. A question I often get is, don't the communities you work with already know how to farm? The response is maybe, but it's complicated. 95% of the individuals in our projects do farm, but often for commercial crops only. They know less about growing horticulture gardens. Additionally, they face cultural and environmental factors that limit the productivity of their land. DIG works to increase yields, improve soil, diversify crops, create garden maps and crop rotation plans, manage water resources, and market produce for sale. DIG does this with local resources and limited inputs, so it's easily replicated and sustained throughout the whole community. We have a high degree of sustained impact because our program stresses sustainability, transference of skills, community ownership, and program replicability. DIG's first project at Fann Hospital in Dakar, Senegal, continues to operate today. It's feeding patients daily and has grown vegetable production levels from 450 to 2,000 pounds every month. Likewise, a DIG-assisted school garden initiated in 2009 with 39 students at the Wiser Girls School in Kenya now supplements more than 20,000 school meals annually and has worked with more than 130 students to teach the practical skills necessary to develop and maintain these gardens. The changing trends in global development and economic stability is a challenge that all international NGOs are facing. Additionally, increased climate variability is an ongoing problem. DIG addresses these challenges by employing approaches that limit the financial burden on local institutions and households while promoting long-term sustainable garden practices. Every DIG-assisted project looks to develop a model that'll endure while considering the economic, environmental, and cultural realities of each community. Our work is an evolving program. We're always learning and building our model, but keep the unique variables of each site at the top of our awareness. With additional resources, we would be able to increase our presence in the countries we are currently in. We're working on strategic and mature partnerships with the Ministries of Health, Agriculture, and Education in Uganda and Kenya to reinforce their capacity to design and accompany gardens and feeding programs. In addition, we're looking to scale up our model into other countries. Our dream is to have every school and clinic in Africa be complemented with a DIG garden and supported feeding program. Plant the seeds, and it's possible. With the right partners, DIG's model can accomplish amazing things. As we grow and further prove our effectiveness, we're looking for strategic partners to scale our impact. We'd love to work with large NGOs, corporations, or other forward thinkers who, with a little teaching from DIG, could implement our program on a larger scale.